Hi, and welcome to our PCMH webinar, Understanding and Managing Anxiety. My name is Vicki Cochran, and I'm the Family Partnerships Program Manager at CMHO, and we have a program to support families across the province of Ontario called PCMH. Today, we have with us our guest, Denise Almeida, who is a social work at HANDS, the Family Help Network. And Denise supports families whose children are experiencing complex mental health needs with system navigation, case coordination, and advocacy, both internally and externally as required. Prior to working at HANDS, Denise worked at the Catholic Children's Aid Society of Toronto for 10 years as an investigator and assessor. Denise has her Bachelor of Social Work with honors, with a minor in psychology from Carleton University. She's also an early childhood education, has her early childhood education diploma from Algonquin College and worked for 8 years in the field of early childhood education. So Denise, you join us today with a ton of experience. Thank you so much for being here with us.
Thanks, Vicki. Thanks for having me.
So this is an important topic that we're hearing a lot about since the pandemic, and anxiety continues to carry on in a variety of ways for families. So maybe we could start talking about anxiety from a place of understanding what it is exactly, because I've heard about it being a basic human experience that we all go through on some level, right?
Yeah. So all of us experience anxiety, and it's an essential thing for our survival. It's basically our body's fight, flight, and freeze response, a kind of built-in alarm system that protects us when we perceive a threat or a danger. And in many ways, anxiety can motivate us to be more productive. Like, for example, a small amount of fear can push us to study harder on a test, or a burst of anxiety can be a lifesaver when it helps us to get out of the way of danger, like slamming on our brakes when a car in front of us suddenly stops.
I've experienced that, so I can speak to that for
We
sure.
all have.
Yep, yep.
It helps to think of anxiety on a continuum. It can
Okay.
vary, sorry, in severity from mild uneasiness to a panic, and it
hmm
can vary in frequency from occasional distress to constant unease that might be impacting our daily living activities.
Okay. So when we think about this from a parent or caregiver's perspective, what should a caregiver be looking for to distinguish between that typical human response that we all kind of experience and when anxiety might need professional support?
Right. So anxiety can actually produce physical symptoms in us, like shortness of breath or sweating, shaking, your heart pounding, nausea, dizziness, chest pain, and even numbness or tingling sensations.
Hmm.
When our child's anxiety is frequent, intense, or prolonged, or it's interfering with their daily life, it's important to talk to our doctor or healthcare provider about these concerns and tell them what you're seeing at home. I think this is always the best place to start your search for assistance with your child.
I actually remember a time with my son, Denise, where he had been knocked down at school and was injured, and they called me saying he can't walk. Like he's saying he can't walk. And so when you talk about that physical response, like actually being a physical response, that was the first time I recognized afterwards. Like I didn't recognize it in the moment because I showed up at the school to pick him up. He was exhausted, he was sweating, he was red in the face, breathing heavily, and just refusing to walk. He said, I can't walk. And I had no idea at the time that what he was experiencing in that moment was actually a panic attack. And I
Mhm.
actually took him to Emerge because I thought maybe he had been physically injured and he got knocked on the ground on the ice. So I thought maybe he has been physically injured severely. And then when we got to the hospital, he started to calm and then everything was working again. And that was my very first experience with a panic attack and realizing it really has a physical impact. So I was shocked at that.
Yeah, it's a real thing that happens to so many of
Yeah.
us, these panic attacks. And I am a strong believer that you know your child best, but it
Mhm.
is important to rule out anything physical that might be happening.
Yeah.
So if your child stops doing things that they once enjoyed, or they begin to display those physical symptoms, complaining about headaches, stomach aches, or starting to have extreme clinginess,
Mhm.
this might be a time when you would reach out to a professional. And again, I believe the best place is always to start with a family doctor or a medical professional to rule out any physical ailments that might be causing the symptoms. Those doctors can also make some recommendations for mental health supports in the community or maybe even at their office. They can also maybe make some strategy suggestions for a parent to go home and try themselves. So I think
Hmm.
it's always important to rule out any physical reasons that may have these symptoms happening for your child. And that is always, I think, one of the best places to start.
Yeah, no, I appreciate that because I think in that moment for myself, I realized how important it was to actually listen to him and what he was physically experiencing. Because at first I was like, you can walk, come on, just get walking. And he was just in such a state of panic and being frozen. And then when I started to validate what he was physically experiencing instead of questioning it, that's when he started to calm down a bit more. So I remember that so distinctly. So I also think about families that we've heard from in our networks where maybe they don't have a family doctor or they have consulted one and they still don't have answers. So, what would you recommend as a next step?
So, I mean, that's the reality for a lot of people across Ontario,
Hmm.
unfortunately.
Yeah.
There are a few places where parents can find help. And for instance, one of them is your PCMH website. On that website, you can find a tab on the main page that's labeled Find Help, and that can direct parents to community child and mental health resources in their area.
Hmm.
The tool is easy to use and can help families connect to services that are offered for free or paid by OHIP. Another tool that I've recommended to parents is Connects Ontario. On that tool, you can text or have a live
Mm.
chat or call and speak to somebody who is a service navigator who can help support you in your search for services in the area. It's a provincial website that offers free, confidential information about services available both within and outside of your community.
And I know our website actually is part of Connects Ontario. They refer folks to our website all the time too. So, it's a great resource. You're right.
It is. And you can also take your child to one of the community child and mental health agencies, speak to qualified therapists, get suggestions for next steps or strategies to try at home. And you don't need a doctor's referral to access those services.
I think that's really important to recognize is that this is something parents can actually access themselves by making that call or walking in the door and setting up an intake appointment. So I wonder if there are any differences in behaviors that parents or caregivers might see in different ages and stages. So, for example, how would you describe maybe the difference in, say, a preschooler versus a teenager?
Yeah. So children can exhibit anxiety differently at different stages in their life. And younger children, you might find become more clingy or cry more than usual. They might complain about tummy aches or not feeling well. You might also note changes in their eating and sleeping routines. In younger children, sometimes you'll also notice irritability or what we might consider out of control outbursts.
So maybe as a parent, you're feeling kind of surprised about what you're seeing. Like, why is
Yeah,
this
like they would
happening?
be
What's going on?
yeah.
Yeah, okay.
Yeah. With older youth, you might notice some behaviors kind of similar to younger children as well, but also possibly like a drop in their grades or a new school refusal. You can
Mm.
see them avoiding difficult situations or new situations. Sometimes they will withdraw from social activities that they once seemed to enjoy. You might also notice or be concerned about substance use to deal with their anxious feelings.
Okay, so lots of different things to look out for. And those would be cues to maybe get some professional help, right?
Yeah. Yeah,
Okay.
definitely.
So while you're in the process as a family trying to maybe get help and seek out some help, what are some ways that parents and caregivers can support their kids at home or in moments of anxiety when it's hijacking day-to-day living?
Some strategies to support your children at home can be as simple as promoting and modeling healthy lifestyles like proper nutrition and eating at appropriate intervals, regular exercise, just even going outside for regular walks with your children. Getting them to spend time with family or friends and good sleep hygiene and routines is very important as well. No cell phones in bed or instituting a no tech time. Start that really young. Parents can model this for their children. And I know that gets tricky, but if they see you taking breaks from technology, it'll encourage them to do the same as well.
That's fair. We're all kind of attached to our phones at this point, right?
Most definitely.
Yeah.
It is a tricky thing. Some other strategies could be mindfulness and meditation. They can be really helpful, but need to be practiced not when your child is experiencing acute anxiety. If they're practiced on a regular basis, your children can be encouraged to draw on what they already know when they're feeling anxious.
So just to be clear, work on it during calm times
Yeah.
so that down the road after they've practiced and gotten good at it, then you can encourage it during anxious times.
Yeah, for sure.
Okay.
Make it a regular part of your week, like spending
Okay.
some time trying to meditate or showing them how to be mindful.
Yeah.
So
Okay.
for younger children, predictability is very important. Routines are very important for children to foster a sense of security and know what to expect next. This is not always possible. So,
Hmm.
in early childhood, though, it is really important to try keeping some same routines for your child. It helps them feel secure, safe, and less stressed.
Okay.
There's also some helpful grounding techniques that you can try in the moment, but again, you need to practice them beforehand. There's something called the 333 rule. It's easily taught to children and it helps them to calm their mind by engaging their senses. So you have your child name three things they see. Encourage them to look around and say what they're seeing out loud. Identify three things they hear, have them close their eyes, and then name the sounds that they're hearing out loud to you, and then encourage them to move three body parts. Have them identify the three body parts, move them, and encourage them to notice the sensations and tell you about them. Kind of helps get them out of what they're thinking and
Yeah.
into like a grounded, this is what's actually happening kind of situation.
I really wish I had have known about some of these strategies when I think back to the anxiety my son was experiencing in
Mhm.
moments like the panic attack, but just other moments too, where I recognize that he was struggling. I know that our family care center has a great resource on how to manage and understand anxiety. And some of these techniques are in there along with some other resources. So, folks, if you're listening today, take a look under the trusted resources for our resource on anxiety there. So, if you are a caregiver who also has your own challenges with anxiety, how would you go about managing your own anxiety when suddenly you're faced with your kiddo now who needs support?
So I think it's really important that we find the strategies that work best for us, and they are going to be different for everybody. So
Hmm.
some people, deep breathing is very helpful. Meditation can be very helpful. Going for a walk outside, taking the time to address your own anxiety before trying to support your child is important. If you have a partner, it would be helpful to ask them if they can take over so that you can do what you need. And I know that's not the case for everybody. So if you're parenting on your own, letting your child know that you too are having some anxious feelings and need to take a minute to take some deep breaths can be a great opportunity to model for your child how you manage your own feelings. And it's okay to
Okay.
let your child know and see that anxiety happens to all of us. And you show them the strategies that you use, and this normalizes these feelings of anxiety as something that we all have and that we can all get through. You are your child's biggest teacher. So parents can also find it helpful to speak with other parents and caregivers who are going through similar things. So joining one of the great parent peer support chapters in your area would be very helpful to support your own mental health, finding community, and even getting some tips from other parents on things that work for them.
Absolutely. I know that our PCMH groups are located across the province, many of them available virtually or hybrid. So if there isn't one in your own community, you can connect with other parents and caregivers through our caregiver connection space. And that's also on our website. And definitely, I know when I was able to talk with other parents about what was going on, I know I felt less alone for sure. And it started to really normalize some of the experiences that we were having in our own home. Speaking of that, I also know that we often hear about kids who don't have behavior issues at school and then break down or have significant struggles at home. And I know that that was my experience. And it often led people in my life to assume that it must be a home or a parenting issue. And I think there's a lot of stigma and shame that lives there. So then I learned about masking, and I get asked this from parents all the time is, what is masking? And so, can we talk a bit about what that is and how to manage it?
I think masking is a bit of a tricky concept. So
Hmm.
if we consider it this way, like no child wants to be different, and children just want to fit in as adults do. So at school, they like behave and try their best to meet all their perceived expectations of what adults and other children in that environment are expecting from them. And that can be exhausting, especially if they're feeling
Absolutely.
anxiety already going into the situation. And then they feel like they need to kind of mask.
Mm,
And it's not likely that that's actually a conscious choice for children. So when they get home and they feel that they're in a place of safety, they let go. And that can look like a meltdown. Um,
yeah.
so it could be very helpful to give your kids some quiet time after school and not have too many expectations from them immediately after, like when they get home. If we think about ourselves, I know when I get home from work, sometimes I'm exhausted and I feel the need to decompress from my day. And there's no difference there from children who have that kind of anxiety going into school already. So,
No, that makes a lot of sense. I think just being a little more compassionate really about that and trying to think about what that must be from their perspective. And I do think about that and I knew that that was part of what my son was experiencing was kind of holding it together all day. But when I really thought about how exhausting that must be, I did change the expectations after school. And I know I got lots of questions from well-intended family members or other folks thinking, well, who's running the show, or how are you holding him accountable, or how is he going to learn how to be responsible for things? And the reality is, sometimes we have to just parent differently to best support our kids when this is happening. And we hear from families that anxiety is getting in the way of kids going to school or community activities or even family events. And you mentioned that's one of the things to watch for if that starts happening. So, what
mhm.
would you say to parents who are trying to navigate this, especially around school attendance challenges, for example?
Yeah, so I think the most helpful place to always start is try and have an actual conversation with your child to better understand what's behind that reluctance to
Hmm.
attend events or school. It could be so many different things. Maybe they're feeling bullied at school and they haven't been able to tell anybody yet, or maybe they're worried about a test. So once you have a better idea about why, then you can actually help them address the concerns or help them with a coping strategy that could help them through that kind of initial anxious feeling. So
Hmm.
it would be really, really helpful also if it's a school situation to reach out to your child's school. There's attendance counselors and or your child's teachers. They can be helpful in better understanding some of the motivation behind their avoidance behaviors. And you can also work with the attendance counselors. That's what they're there for, to build a plan to get your child back to regular attendance. It's not always
Yeah.
possible to just start from that place. Sometimes it's a day a week or a couple of days a week, or so everything will look different, but you need to use the resources around you.
That makes a lot of sense. And I think there are a lot of families who are a bit hesitant to share that kind of personal information about what's happening at home or with their child's health with the school. But I think if we could shift the lens to see schools as a partner in our child's life and try to help understand and collaborate with them, that can be a good place to start. And we also actually have a resource on our website in our school mental health backpack on how to have these conversations with the school and also connecting with our school mental health one-to-one peer supporter could be helpful too. Because again, those conversations aren't always easy. And maybe you don't have a relationship with the school yet, but it's good to start somewhere, right? With building
Yeah.
it.
Yeah.
What about when you have a kiddo that isn't wanting to talk about it? So I hear this from parents a lot because you're suggesting start with a conversation with your child, but
Mhm.
what if they don't want to talk to you about things, or maybe they don't even know themselves what's going on? What can a parent do then?
Yeah, so that's a tricky one too. You want to try to normalize these conversations about anxiety with your children.
Hmm.
Try to really listen to what they're saying and validate their feelings. And also try to do this when they're not feeling anxious or exhibiting some of those feelings. Encouraging your children to have like outlet activities, I like to call them, journaling or painting, creative type of activities, or
Okay.
alternatively physical activities. These can also be really helpful ways to get some of that nervous energy out of us. And remembering to take care of yourself. Like we can't pour from an empty glass. So there's the wonderful parent peer support that you guys run, where parents can talk with other parents who may be going through similar situations with their children. Parent peer support can be found on the Family Care website. And then for our children in Ontario, there's One Stop Talk. And this is a provincial initiative where your children under the age of 18 can speak to an actual qualified therapist. And maybe, if needed, they can get further resources for services in their own areas. There's always Kids Help Phone as well. It's not
Hmm.
staffed by professional therapists, but many children find it really helpful to speak to people that aren't their parents.
Yeah.
And that's all right if that helps them. So,
Yeah, I was going to say we aren't always their person, right? And
yeah.
that's okay too, as long as we are able to help support them connecting with someone that can help. And so you're absolutely right about One Stop Talk. Being able to connect immediately with a therapist, I think, is a great initiative happening across Ontario right now, where organizations like yours, HANDS, all the community child and youth mental health organizations are working together to try to meet the needs of kids in the moment that they need it. So I know Kids Help Phone and One Stop Talk are also flagged on our website. So parents only need to go to our website to find what they need. I know we hear from families that they aren't really sure what resources to trust on that note, which is why we developed our Family Care Center. Given you're a trained social worker actively supporting families with anxiety, what are some other resources you would recommend they consider checking out for more information?
So, the current best practice for addressing anxiety is what we call cognitive behavioral therapy, and you'll often hear it referred to as CBT. So,
Okay.
this is an evidence-based treatment that's often found to be very effective. It's short-term, it's structured talk therapy. It helps identify unhelpful thinking and maladaptive behavior patterns. It focuses on the interconnectedness of our thoughts and our feelings and then our actions.
Okay.
Therapy helps us challenge distorted thoughts and practice new, healthier ways of responding to challenging thoughts and situations. And this therapy can be delivered by trained professionals in any of our local children's mental health agencies.
Which folks can find on our website with the Find Help tool, right? Where their local free publicly paid services are. Yeah.
So there's also a couple of books that we generally do recommend for parents and for children.
Okay.
There's Keys to Parenting Your Anxious Child, and this was written by Dr. Kay Manassis, who was a psychiatrist from Sick Kids Hospital. It's a great book. It's laid out really nicely. There's another book, and this one's targeted at children from 6 to 12. It's called What to Do When You Worry Too Much. It's a kid's
Mm.
guide to overcoming anxiety. It has practical tools for children to use and then supportive notes for parents and caregivers.
So something
Um,
you could even introduce to your child themselves to use. So it kind of
yeah,
empowers them to look at it
yeah,
themselves too. That's
yeah.
great.
It's really helpful. And then there's some trusted websites that we like to use. One called childmind.org, where you'll find some evidence-based resources to spark conversations, teach your children essential mental health skills. And of course, the CMHO PCMH Family Care Center that has many resources to support parents who are searching for support for their anxious children. And then also, both Sick Kids Hospital has a page called About Kids Health, and CHEO, which is Children's Hospital of Eastern Ontario, has
Yeah.
a resources and support tab with lots of helpful information to support every parent's learning journey.
Amazing. Wow. That's a lot of great resources and many of them are also flagged on our website as well. So the Family Care Center really is that one-stop shop to go find resources, find services, and find out more about how to support your family and support yourselves through our peer support program, Caregiver Connection. Thank you so much, Denise, for talking to us today in such detail. I think that sometimes it can be really overwhelming to navigate figuring these things out. And I appreciate all of your insights today and all of your recommendations. And any parents and caregivers watching today, feel free to share this webinar with others that you know might be struggling with this. And get in touch with us if you have any questions by emailing support@pcmh.ca. Thanks so much and take care.
Thank you.